Hi everybody, this is Judy at Judy in the Kitchen. Today we're talking about the nutrition and health benefits of chia seeds. Chia seeds really are tiny but nourishing. There's a lot to be said for chia seeds. They're high in fiber and they have a lot of protein in there with an actual good balance of amino acids. So you can consider them to be a good source of protein. They have some omega-3 fatty acids, vitamin K, calcium, manganese, magnesium, and phosphorus. And they also contain some zinc, niacin, potassium, selenium, copper, vitamin B1, vitamin B6, and folate. They're naturally gluten-free, they're non-GMO, and they're also high in antioxidants that help to preserve the fatty acids that are within those seeds. So they have a lot of valuable health benefits in them. 2 tablespoons of chia seeds supplies about 140 calories, so they are not a low-calorie food, but they're a nourishing food. Now, regarding the health benefits, weight control is one of them. There's a lot of soluble fiber in chia seeds, and that fiber helps to absorb a lot of water, and it expands when it's in the stomach and the digestive tract, and that helps to increase our feeling of fullness. It slows down the absorption of food and helps us to feel full longer. And the high quality of the protein in chia seeds also helps to reduce our appetite and ultimately helps to reduce our food intake, at least for that day. In 2017, a study was reported in the journal Nutrition Research and Practice, and they showed that eating chia seeds for breakfast does help to increase our satiety and reduce our food intake in the short term, in other words, for that day. So that's a good thing. Another study was reported in 2017 in the journal Nutrition, Metabolism, and Cardiovascular Diseases, and they found that chia seeds help to promote weight loss in obese individuals with type 2 diabetes who were on a reduced calorie diet. So if you fall into that category and you're trying to lose weight, including a little bit of chia seeds, especially with your breakfast, can help you to feel full longer and help you to not nibble on foods quite as much as you might normally do. They're also high in omega-3 fatty acids, as we mentioned earlier. Gram for gram, chia seeds have more omega-3 fatty acids than salmon. Now, we want to understand the perspective here. When you eat salmon, you're going to eat a larger portion than you will of chia seeds. So you may get more omega-3 fatty acids out of the salmon in one setting than you would out of chia seeds. But when compared gram for gram, chia seeds are actually higher in the omega-3 fatty acids. Another point on this is the fact that the ground or the milled chia seeds will actually release more of the essential fatty acids than the whole chia seeds when we eat them, because we don't break the whole chia seeds down all that well in the digestive process. So if you can grind them up first, you're going to get a better nutritional value out of those chia seeds than if you just ate them whole. They may also help to lower our risk for heart disease, since they're high in fiber, especially soluble fiber, and protein, and omega-3 fatty acids. All of those factors can reduce our risk for heart disease. And studies have shown that chia seeds can reduce our triglycerides, reduce inflammation, and even insulin resistance. And it may also help to raise our HDL, or our high-density lipoprotein cholesterol, which is the kind of cholesterol we need to come up a little bit. And all those factors can help to reduce our risk for heart disease. A few studies have also shown that chia seeds may also help to reduce blood pressure in subjects with hypertension. So if you are on your way toward heart disease, maybe you have chronic inflammation, maybe you have high blood pressure, try including a little bit of chia seeds in your diet, especially for breakfast if you possibly can, and it may do a lot of good for your body. They may also help our bone health. They're high in nutrients that support bone health, including calcium, phosphorus, magnesium, and protein. And 1 ounce of chia seeds provides 18% of the recommended daily intake of calcium. And so that makes chia seeds an excellent source of that mineral that we seriously need. It is noteworthy, I know some people are going to bring this up, that chia seeds do contain phytic acid. And that phytic acid can bind to calcium and the other minerals within the chia seeds and help to reduce our ability to absorb those minerals from the chia seeds. So it would help to soak your chia seeds before eating them, and that'll help to release that phytic acid and make those minerals more accessible to your body. Also, since we know that chia seeds are very thirsty little things, it's good to soak them first, if for no other reason, to allow them to soak up some of that moisture first before you eat them. Please do not eat chia seeds dry, just like by the spoonful out of the package and just chew them and swallow them. That is not good. That is a choking hazard. They're going to soak up a lot of liquid once you swallow them, if you swallow them dry. And they can get stuck in there. They can cause blockages. They can cause you to choke. So please make sure you soak them or ingest them with plenty of fluid along the way. Preferably soak them first, though, so you don't run into any sort of a risk by trying to eat them dry. They can also help to stabilize blood sugar levels. When we eat meals, a lot of times our blood sugar will tend to increase some based on whatever we're eating in the meal, especially if we have a load of carbohydrates of some sort. Well, the fiber in chia seeds and the protein as well can help to stabilize that blood sugar so we don't get this big spike in it after the meal. And that in turn can help if you've got diabetes or pre-diabetes, or you just tend to run a little bit on the high side, or you maybe get a sugar spike and hypoglycemia and you get the shakes out of it. So you don't want that. So the chia seeds can help to ward that problem off and keep your blood sugar level. Chia seeds may also help to reduce inflammation. And now, inflammation is a normal body process. It's a response to injury or even infectious agents, bacteria and viruses that we may have in our body. Chronic inflammation is what we have as a problem. That is an instigator, increases our risk for heart disease and cancer, and some lifetime habits can increase our risk for inflammation, like smoking or exposure to certain chemicals and inactivity and a poor diet. On the contrary, other lifestyle habits can reduce our risk for chronic inflammation, and diet is one of those lifestyle habits that we can get into that can help to reduce our risk for chronic inflammation. Chia seeds can help to do that. There was a study published in 2007 in an issue of Diabetes Care, and they showed that subjects with diabetes who ate 37 grams, that's about 2.5 tablespoons of chia seeds every day for 3 months, had reduced inflammatory markers. And so this is really an important point, because they're not going to work like an aspirin pill for a headache. You've got to do this over time, consistently, and if you miss a day or two, don't worry about it. Get back on the bandwagon as soon as you can, and just relatively as often as you can, consume the chia seeds, add them into your diet as you can. And over time, it may help to reduce your inflammation. And by doing that, it can help to reduce your risk for cancer and heart disease and a series of other diseases as well, eye diseases and brain issues, Alzheimer's disease, all sorts of things. Now, there is a note of caution coming along with chia seeds, other than the one I gave you earlier about please don't eat them dry. Omega-3 fatty acids can have some blood thinning effects. If you are taking blood thinning medication and you want to suddenly increase your intake of food that can have the potential to thin your blood, like chia seeds might do, or anything that's high in omega-3 fatty acids, you want to check with your healthcare provider first about how many you can add or how much you can add to your diet at any one time safely without seriously affecting your prothrombin time, the thinness of your blood. You don't want it to get too thin because that can lead to other types of serious problems, a stroke being one of them. So you don't want that. I do hope this helps. This is Judi at Judi in the Kitchen. Bye for now.